Good morning, good afternoon, everyone, depending on where you are watching from. I want to welcome you to the Preventive Care webinar. I want to especially welcome you and thank you for showing up. This is the Preventive Care webinar, and we're going to be learning about essential skills for a lifetime of health. Essential skills for a lifetime of health. And that is what we're going to be talking about and sharing on today. So you might do yourself good to get some writing materials, get your neighbors, get your friends, get your people all around so that you can participate fully in this webinar and learn strategies that can help you improve your health, improve the health of your family members, and improve people's health, generally. So we are going to be talking about preventive care and how that pertains to you. You're going to be learning about what preventive care actually means and the nitty-gritty of preventive care and how it can help you, improve your health in ways you can't even begin to imagine, right? So that's what we're going to be learning about today. So you're going to do one thing. Take the link that brought you here, put it on your status, put it on your group, put it on your family group, put it on different places so that the link that brought you here can also bring others here, right? So take the link, put it on your WhatsApp status, put it on your Facebook, put it on your Twitter, put it on your Telegram, put it, on different places so that other people can also participate in what we are doing. If you love your family, if you love your friends, give them this link because by the end of this session, they also are going to, benefit a lot of things that will really, transform their health. So take the link that brought you here and then put it in other places. Put it on your WhatsApp, put it on your Facebook, send it to your friends so that they can also join. I'm going to give you 30 seconds to do that. Check the link that brought you and put it out there so that others can join. Giving it to your friends, you've taken it all around, and then they'll be joining as we move on. So, once again, I want to welcome you to the Preventive Care webinar where we're going to be talking about health, top health, and simple health strategies that you can use to radically improve your life, and make sure you sustain health. We are going to be talking about steady, robust health and how to achieve that even from where you are. All right, that is what we're going to be talking about today. So let's delve right into it and get going. If you're excited, you can put your comments in the comment section and then keep sharing and let more people join. All right, so here we are. Without further ado, we're going to get into the meat and what we have for today. I am Prosper Nwiwu, the founder and CEO of Lawson Health, which is a public health company, that seeks to educate people and help them on their path to steady, robust health. And we've been doing this for quite some time now, over the years, and we've been trying to educate people on their health, how to stay healthy, strategies they can use to improve their health, and so on and so forth. So that is also what we are here to do today. We're going to start by talking about preventive care. So if you have your writing materials, get them down, so that you can write down things, you can begin to learn things, right? So the first thing I'm going to say today is for you to be teachable. There's something called teachability. There's something called teachability. And what that means is your willingness to learn and your willingness to change. Your willingness to learn and your willingness to accept change. That is what teachability means. So in this session today, I'd like you to be very teachable because there are so many things you're going to be learning that are new to you. There are so many things you're going to be hearing that you've probably not heard before. So it is essential that you pay close attention and listen and learn so that your health can improve, so that you can achieve steady and robust health. Your health will not just be steady, but it will be something that is growing, robustly, right? So be teachable, maintain a teachable attitude, maintain a teachable spirit, maintain teachability. Be ready to unlearn some of the things you know before and grab new things and learn new things. Be ready to learn new things. That is very important, because if your mind is closed to learning, then everything we're going to do today will not benefit you. So it is essential that you keep an open mind. Be open to learning, be open to change. Be open to learning, be open to change. That is the first lesson today. That's the first thing you have to understand today. That you have to be open to learning and open to change. Open to learning and open to change. Now, that being said, it would interest you to know that in 2023 alone, there were about 63 million deaths recorded. 63 million deaths. That's a very large number, and these are just the recorded ones. If you do a proper check and calculate everything, every death last year, you see that it exceeds that number by a very high amount. It exceeds that number. You should be talking about 100 million deaths, right? But these are the recorded ones. The recorded ones are just about 63 million deaths. Now, in all of these deaths, about 70% of them, 70% of these deaths were caused as a result of something called non-communicable diseases. Non-communicable diseases, NCDs. And these are things that are not caused by maybe a natural disaster or something like COVID that is communicable, that people can pass on from one person to another. These are not such things. These are things that are caused as a result of people's habits, the way people live, the way people behave, people's health habits, right? About 70% of the deaths that occurred last year, according to statistics and the World Health Organization, were as a result of people's health habits. And it's caused them some diseases like diabetes, like hypertension, and so on and so forth. So about 43 million deaths, which is the 70%, were caused as a result of the bad health habits of people. Now, what does that tell you? It tells you that the bad health habits of people is a leading cause of disease. So when we attribute the causes of death to things like cardiac diseases or diabetes and all of these things that we know that are popular all around, we neglect something very crucial and basic, such as bad health habits. So we should start from health habits first of all to be talking about it, right? And begin to take a proactive approach to healthcare, which is why we keep talking about preventive care. All right, so what is preventive care? What is preventive care? Do you have any idea what preventive care is? Have you heard about it before? Think about it. What do you think preventive care is? Now, preventive care, I'm going to answer that by painting a picture for us so that we can understand it even to the basics, to the basic concepts, because understanding is key. If you understand what preventive care is, then it has begun a revolution for you when it comes to your health. So what is preventive care? I'm going to give us several instances. Okay, let me use something like malaria, right? So the average Nigerian, when an average Nigerian wants to treat malaria, or when we talk about malaria for an average Nigerian, what they usually do is that they begin to experience symptoms. And when they begin to experience symptoms, they go to the hospital or the health facility or the pharmacy, wherever, or to the hospital, and then they explain their symptoms. Usually when the symptoms have gotten really bad, maybe they are having a lot of, the headache is so much, they are having fever, they are sweating all over, and other symptoms. So they go to the hospital and they complain, I'm experiencing this and this and that. And then the doctor diagnoses them and then gives them some medical advice and probably some medications to take. That's the typical way it happens. So an average Nigerian would wait for symptoms to come. And not just for symptoms to come, they'll wait for the symptoms to get really bad and even worse before they start seeking medical attention. But preventive care means you are not just waiting for symptoms to come, you are taking proactive measures. You are taking actions to ensure that your health is stable. So actions like, keeping a clean environment, fumigating your environment, sleeping under a treated net, taking proactive actions to prevent getting malaria. Do you understand that? Taking proactive measures to prevent malaria instead of waiting for it to come. Do you get the idea? So that is what preventive care is all about. Preventive care is all about taking actions to maintain your health, taking actions to protect your health, taking actions to ensure that your health is growing on a steady basis, not waiting until symptoms come and get worse before you start taking action towards your health. It's very important we understand that. So, preventive care is something that everybody should be practicing. Preventive care is something that everybody should be practicing. When it comes to other areas of our lives, we tend to practice preventive care, such as when it comes to our finances. We save money for the rainy day. We take actions to ensure that we won't be broke tomorrow, and we do some of those things. But when it comes to our health, we just think that we are healthy by default, and then we don't really take action toward our health. So that is what we're going to be talking about today. And then strategies to begin practicing this preventive care and also to grow our health on a steady and daily basis. So we have an expert who is going to be talking to us on this subject. I'd like you to pay close attention, bring your people around, your friends, your family, because you're going to be learning so many things that by the end of this webinar, you go home, you go out there, and your health will radically improve. Your health will radically improve. You can actually see that your health is the difference. You see that the practices you've learned will help you to improve your health. So without further ado, I'm going to be introducing our speaker for today. His name is Dr. Rubicon. He has been in the medical field for a notable time, and he has a lot of experience. And not just that, he's very passionate about healthcare, and he's going to be talking to us on this subject. So put your virtual hands together as we welcome Dr. Rubicon into the house. Dr. Rubicon, welcome.
Okay, can you hear me, Prosper? Can you hear me? Your mic is
Yes, we
muted.
can hear you.
Your mic is muted.
Yes, we can hear you. Go ahead. Thank you.
All right. All right. Thank you so much. Okay, so good afternoon, everybody. Good afternoon, everybody. It's nice to be here. Okay, so without wasting much of our time, let's just go down to the business. Thank you so much, Prosper, for the introduction. This is really amazing. Yeah, so I'm sure you guys noted when he said you should get your pen and paper. That's very important
That's
because
very
we're
important because
we're going to be learning a
we're going
lot.
to be learning a lot.
Prosper, just mute. Yeah.
Prosper, just mute. Yeah. All right.
Yes, the back this thing. Yeah. So if I need you to respond to something, I will just call you. But just leave your face there, so I'm sure we are together. Yeah. All right, so let's go on. Welcome to Preventive Care Webinar 1.0. Okay, I'm sure when we are done with today, you're going to be expectant for the next season, for the next episode. Okay, so let's just go down to business. So, welcome. If you've not posted the link on your status, on your group chats, on your pages, please do well to do that right now. Okay, thank you. You're welcome. Okay, so let's go. Um, Prosper has already done justice to the introduction, but just to buttress some of the points he has already made, preventive care. What is preventive care? Let's start with that. Okay, so preventive care refers to healthcare services and measures that are designed to prevent illness or detect health issues at any stage that is particularly early. Okay, so at an early stage in simpler terms, aiming also to maintain overall well-being and then avoid development of more serious conditions. That's actually the aim. Okay, so the key word there is proactiveness. Okay, so examples of such things would include vaccination, one, screening, two, lifestyle counseling, three. Okay, so I said it refers to healthcare services and measures that are designed to prevent illness, one, detect health issues at an early stage, two, aim at maintaining overall well-being, three, and then avoid development of more serious conditions. That's 4. Okay, so you've heard things about vaccination, screening for some diseases, and then lifestyle counseling, things like exercise, all those health habits that we are going to talk about as we move. Okay. Also, somebody can also define health, preventive care as something that encompasses some medical interventions, some strategies that are focused on averting the onset or progression of diseases. So, two things: it averts onset, that's that disease starting even in the first place, or the progression of that disease. So, all of these things are targeted at getting it at an early stage. Okay. So, this would include um basically, like I said, something like a um immunization that actually helps to thwart infectious disease, regular screening for early detection of conditions like cancer, hypertension, and all of those other communicable diseases that Prosper has already introduced to us. Okay, so and also healthcare counseling, like I mentioned to promote lifestyle choices, that are conducive, okay, towards or targeted at disease prevention, basically. So I will have to introduce you guys to what I call HHH, okay? HHH. Remember, today's topic is about development of healthy health habits, right? That is also targeted at preventive care, okay, with preventive care in mind. All right, so I'm introducing us to HHH, what I call HHH. That's healthy health habits. Okay, this refers to a set of positive behaviors and routines that contributes to overall well-being and optimal health. Okay, so these habits that we are talking about, typically it includes like practices such as regular exercise, balanced nutrition, sufficient sleep, stress management, avoiding harmful substances, adopting and maintaining, these habits, like I mentioned already, can actually promote your physical, mental, and emotional health. Physical, mental, and emotional health. I'm going to still dwell on some of the examples I'm giving. This is like a preamble. Okay. So please, Prosper, when my time is up, remind me, okay? Yeah, so let's go. Let me try and rush. So in a medical context, HHH, I mean healthy health habits, denotes evidence-based behaviors aimed at maintaining and improving physiological and psychological well-being. Okay, I'm sorry if I'm rushing. Okay, so this encompasses adherence to things like a nutritious diet, that's balanced diet, as you guys know. Things like engaging in regular physical activities. I'm sure many of us are lazy to do these things. Okay. Okay, unless you're watching your height and complexion anyway. So obtaining adequate sleep, that's also important. Managing stress effectively, abstaining from harmful substance, like I already mentioned. And all of these things is just there to contribute towards disease prevention, optimal organ function, and of course overall health promotion. And the thing about what we are talking about is that as far as preventive care is concerned, building lifelong health habits involves a balanced approach, towards all of these things we've already mentioned, you know, and because everything has to be done in moderation at recommended, basis. So we need to prioritize our, preventive care, basically with aim of making sure that our overall health is maintained. And now, I will have to say this: consistency is key. Okay, small sustainable changes over time, is what we are looking out for. Those are the things that brings out lasting results. Okay, so having said that, I would have to just introduce us to some of these habits I'm talking about. Then we'll go around about it. So one, I would have to do something that will be uniform to help us remember. So most of the things I'm going to be talking about will start with the letter P. Okay. All right. So one is physical activity. Physical activity. So this, in simpler terms, I'm going to just cut everything short so that we can, you know, get into the other interesting part of this conversation. So one is physical activity. This one has to do with engaging in regular exercises to promote, cardiovascular health and overall well-being. Of course, you guys know the importance of exercising, regularly. And you don't have to do much. You just have to wear your clothes and, hit the streets or go to the gym, you know. Yes. Okay. Second thing is proper nutrition. Of course, it has to do with balanced diet, food that are rich in fruits, vegetable, lean protein, whole grain, and less of fat, salt, all of those things. All right. Then portion control. Of course, as much as you want to eat balanced diet, you have to also look at what you are eating, the size and all. So we are not looking at quantity here. We are looking at quality. Okay. So you have to manage portion sizes to avoid overreacting and in order to maintain a healthy weight. Okay. Four is preventive screening. Okay. This one you have to go for scheduled routine health checkups. Okay. Screening to detect potential issues, early, early enough. Then preventive vaccinations, you have to stay up to date with your recommended vaccination, be it COVID, just to prevent infectious disease, COVID, yellow fever, any of those ones that okay. Hepatitis B, very common, okay. Yes. So far you are exposed to such things, okay. So far you're a health worker, probably you work in a hospital, you walk around places that you have to use sharps and all of those things. It's important that you do these things. Six is um proactive approach. Okay, this one has to do with taking initiative in maintaining health by staying informed about preventive measures. So you read the news, you try to google the latest updates, try to read and follow through what is happening around you as far as preventive care is concerned. Another one is to prioritize your sleep. Okay, very important. Yes, I know you are trying as a young man, as a young lady, you are trying to be, you know, to make ends meet. You're a workaholic, you are CEO of that, CEO of this. Okay, it's important that you sleep. So ensure adequate and quality sleep for optimal, physical and mental and emotional function. And of course, the recommended sleep hour will be like around 6 to 8 hours. Okay, average of 7 hours. Okay, very important every day. Try. Okay, so the next number eight is to personalize fitness plan. Okay, you have to tailor down your exercise routine, okay, to your preferences, the needs for sustainable commitment, because there are some things you might start up and you cannot maintain them, and that will be bad. That's why we give up on things. Okay, so you have to be reasonable, it has to be smart. Okay, number nine is prudent hydration. Okay, you have to maintain proper hydration. Okay, level up. Okay, level up, you have to take water, as simple as that, like a Boko doctor would say. Okay, it will help. Water is very important. In fact, it's even one of the classes of food to help you with your bodily function, with your overall health. Then number 10 is psychological well-being. You know, in Nigeria right now, a lot of us, we are going through a lot. So, and we don't assess some of these things. Some people don't have never attended any therapy session in their life, and we take these things for granted. Anyway, I'm just saying that we should address and manage stress, through relaxation technique, coping strategies as well. If need be, find a therapist. It's very important. We are going through a lot, I know. So that's why I'm bringing this up at this time. Okay, so let's go on. Positive mindset. Okay, that's very important as well. So no matter what you're going through, whether, because sometimes you might not be the one that is sick, just that the fact that somebody that you love or you care about is sick or has a chronic illness, you in your mind, okay, you are down, you are depressed, then let's not talk about the other part of what Nigeria is doing to us and other things that we are trying to do to sustain ourselves. So positive mindset, very important. So you have to foster a positive outlook on life generally. That's also help you to reduce stress and enhance mental health, which is also a very important aspect of preventive care. Okay, number 12 is peer support, very important. Okay, so seek encouragement and accountability from friends and family in maintaining health habits. Okay, draw out a plan. Have somebody that sounds like your conscience. Okay, somebody that supports you, somebody that you share some of those plans with. Okay, your schedule, your plans, and all of those things. Okay, somebody that might even be calling you say, have you gone to that checkup? Have you gone to see your doctor? Stuff like that. Your appointments, your monthly appointment, 6 month appointment, 3 months, stuff like that. So also you need to pace yourself. Okay, to avoid being worn out by gradually incorporating healthy habits into your routine. Don't rush all of these things I'm saying. You have to take it bit by bit. You can get a journal, create your to-do list, daily, monthly, all of those things. Just anything to help you. Okay. periodic check-ins as well. So you have to also go for a regular access, okay, to assess your health habits. Check the ones you've actually adopted, the ones you need to adjust, the things you need to do, the things you need to edit, to delete, to unlearn, relearn, and even the fresh ones you need to learn. Okay. Then the other thing there is about public health awareness. Okay, you have to stay informed. I think I mentioned that before. Okay, about the recommended guidelines, and health strategies. Okay. Another thing that is very important is positive outlook about physical health education. You have to actually continually, educate yourself on maintaining physical well-being. Also, pamper your mental health. Very important. Engage in activities that bring joy and relaxation. Okay, I can't stress that one enough. Okay. Then also you also need to know about uh, positive social connections. Okay, cultivate positive relationships to maintain mental and emotional health. That means some days you have to stay offline, some days you have to focus on what is important in your life. Very important, because some of the times you just go to look for trouble where there's no trouble. Okay, please. All right, very important. Also, cancer screenings are very important. Now I have to share a story. There are, I don't know whether any of you have heard about pap smear. Okay, the one they do for cervical cancer. Even regular checkups. Women need to know about breast examination. Stuff like that. It's very important. So about this screening, I had a story in mind. I said I will share. And now this is the lesson. I have to share the lesson first. Then we'll talk about the story. Wisdom is the antidote to anxiety. Let me repeat. Wisdom is the antidote of anxiety. If wisdom is on the dining table, okay, anxiety runs away. Okay, you will not see anxiety in that table. Anxiety will not even become Judas Iscariot. It's not going to betray anybody. And this is the point. When you know what to do, you'll not be afraid. You'll not be scared because you know what to do. In fact, at that point, even some of your mistakes will not look like mistakes because you also know what to do next. So from now on, let's say you've been making a lot of mistakes about your preventive health, you've been taking it, you've been indifferent about it, you've not been taking anything serious about your health. This is the point. My point is that is prevention. They say is better than cure. Okay. Okay. You could do prophylaxis, which is prevention, rather than treatment. Okay. So there's this story about an athlete. You guys know Angelina Jolie. Okay. Just some time ago she underwent double mastectomy. So though she wasn't, diagnosed with breast cancer yet. It's just that she has family history, positive family history of breast cancer. I think it was in her mother and then her grandmother. So it was really wise for her to choose to do this, seemingly difficult operation. Choosing that operation must have been an extraordinary, difficult decision. Okay, even going public with it must have been equally difficult for her. But she had to do that. She had to tell women a story that prevention is better than cure. That you can, when you do some of it, she had this gene, okay, a gene. She carried a gene called the BRCA1. And that gene, it increases the odds of developing breast cancer, even ovarian cancer. So she was just being proactive. Proactiveness is very important with these things. And seeking the right help and at the right time. Those are the important things because you can actually get help or you get it late. So it's important. That's why prevention. If you go back to our definition, it has to do with detecting these things early enough. So this woman had to do prophylactic mastectomy, removing her both breasts. Before she even was diagnosed with breast cancer, and she has never been diagnosed. And I'm very sure that her chances have been reduced drastically. And this is someone that has, she's been out there. She's very popular and all of that, but she wouldn't allow, what the public would say to, delay her from doing what is right for her health. And what she did was to seek the right help and seek the right counsel and got it done. Okay, so it's important. I know some of us, I don't know, we need to know about like cholesterol management as well, monitoring your cholesterol. This will help reduce risk of heart disease. Some of us also need to learn about CPR training, because you might need it to save a life in public. So pick up some of these courses online, even if you are not like medically inclined, just learn. Some of those might come in handy for you. Okay, all right, very important. Okay, eat clean, balanced diet, and avoid some of these things. Too much salt, too much oil, all of those things. Junk, fried food. Reduce it. These things. Take your health seriously. So also, family planning is important. I'm talking about contraception. Okay, this one is for women. This one is for women. Okay, this one is basically for women. Very important. Okay, if you have chronic diseases as well, please make sure you are managing it very well. Things like diabetes. If you have someone around you, make sure you are taking their health seriously as well. Okay, if you've not done pap smear, please do that for your cervical health and cervical screen. If you're not taking the vaccination as well, do well to take it as a woman. Okay, all right, very important. If I cannot emphasize on this thing, childhood vaccination is also very important. Vaccinate your child. Don't take it lightly. If you are pregnant, pregnancy is not an emergency. Go to your antenatal care visit. Take it seriously. Be routine. Be compliant with things with the patient. That will help you, help save your life and the life of your child, and also give you a life healthy baby. You can give birth to a baby that is not healthy, and you have to suffer through life, and the baby will suffer through life. Some of them might even resent you for it. So let us not take these things lightly. Okay, if you are an albino, take caution with your sun exposure. Okay, because you have to protect your skin from UV rays and prevent skin cancer. These things are things that are popular. Some of you must have heard it before. Okay, if you are, don't abuse drugs. Don't do substance abuse. Okay, don't go and take high. Just because you want to get that feeling. It wouldn't last forever, but it's going to cause you a problem that will last long. Okay, prepare for crisis. Okay, save money for these things. Health insurance is very important as well. There are a lot of things to talk about, to be very honest. A lot to talk about. Okay, a lot to talk about actually. Okay. So also take child preventive measures. Okay. It's been shown that there are measures you take to minimize childhood injuries. Things like fall, like burns, cuts, sports injuries, bicycle accident, playground accident, poisoning. Okay, there's something called childhood poisoning. Choking, when they choke with small objects and food particles, maybe bone and the rest, coin, animal bites, you keep a dog in your house, car accidents, all of those things. Whatever you do with children, make sure you are being proactive. This is also part of preventive care. Okay, preventive care. These diseases that we're talking about, these conditions that we're talking about, these circumstances we're talking about, they are not only preventable, they are predictable, they are controllable. And failure, just like success, is controllable, is preventable, is predictable. So please, guys, please, I beg us to really do these things. It's important that we communicate these things. Okay, there's a lot to be said. Okay, there's a lot. You have to have have a clean hands and clean environment. Even in a pollution-free area, positively impacts your health. Is one major thing we talk about in public health. Maybe it's COVID-19, any of those diseases. Clean hands, proper hand hygiene is also a simple, yet effective measure to prevent infections. You come back home, you and grab something from the fridge. Go and wash your hands also. Go and wash your hand. Very important. Wash your hand first. Don't go and carry your baby with that hand. Wash your hand. In fact, take your plate. Okay, and then come back to do other things. All right. So also, if you have any health plan that you see around, okay, that is approved, okay, not all those Google things and the rest of them, one drop to cure plenty things. Please don't do that. Don't do that. Okay, don't do that at all. All right, don't do that. All right. So I will end with this because I think our time is fast spent. Okay, I think Prosper is just trying to give me time. Prosper, you there? let me round up with this, okay? You can come back up so I know you're there. Okay, you're there. All right. So let me just round up with this West African perspective, okay? There's something called West African perspective, and I'm going to just use this story, and this quote just wrap up what I'm about to say. Remember, let's have in mind what preventive care is. I'll define it again. I said preventive care refers to healthcare services designed to prevent health issues at an early stage, aiming to maintain overall well-being and avoid development of more serious conditions. Okay, so it's like something that encompasses medical interventions and strategies that are focused basically on averting illnesses. The onset and progression of disease. That is just it. So, and I've said a lot of things, a lot. I've said a lot already. Okay, just to be able to bring it home, make it make sense to us. And please, it's important that we communicate these things around. Don't close your ears. Don't let this information enter from one ear and leave from the other. Okay, so back to what I was saying. West African perspective. I call it PAS. PARS. Capital PARS. So the P is powerlessness. A lot of us are not empowered, and that's the problem. And that is why we're having this webinar. We want to empower you with knowledge. Let's tell people that ignorance is part of knowledge because you can actually know nothing. Yes, you can actually know nothing. So when you're not equipped, you are powerless. When you don't know what to do, you are powerless. When you don't have the resources, be it in the pockets, okay, or in the brains, you are powerless. So one is powerlessness, and we see it every day. It's the West African perspective. In Africa, in Nigeria, that's the problem. A lot of us are not empowered, so we are powerless. The next one, I remember I said pass. So A is the next one. We just deal with P, which is powerlessness. A, attitude. So there's something I call the pig attitude. Okay. So let me just mention it and then I share a story with us. So pig attitude, PIG, capital PIG, pig. Eh? So P is for poverty. Okay. Whether you're poor in your pocket, poor in the mind, very serious matter. I is for ignorance. Okay. Like I said before, when you don't know, there is nothing you can achieve. There's just the least you can achieve is nothing. Okay. Good. Now the next is G, which is gross irresponsibility. Some people are not just irresponsible; they are macroscopically irresponsible. You can palpate the level of their ignorance and the level of their irresponsibility. Okay, so that's the big attitude: poverty, ignorance, and gross irresponsibility. So if you are poor, I used to tell people if you are poor and you are ignorant and you are grossly irresponsible, you are doomed for life, and that is just the truth. So remember, pass. Okay, we are done with P, which is powerlessness. A, attitude, which I said is the big attitude: poverty, ignorance, gross irresponsibility. That's PIG, pig. Then R is religion. This one, everybody knows this one. Okay, we suffered it a lot. Okay, somebody is sick, instead of going to the hospital, the person goes to the prayer house or the healing school, all of those things. I'm also a Christian. I don't have any issues with miracles and healings and all of that. Spiritual healing, it happens. Okay, but it's just like rainbow. It doesn't happen every day. Okay, Jesus did not do miracle every day. He stepped out. Okay, so we should get things right. You cannot substitute prayer for hard work. You cannot do work and leave prayer and survive because there are things you cannot do for yourself. Okay, that's why you pray. Okay, that's why you have relationship both vertically and horizontally. Okay, that's why you honor God and honor people. But there are also things you need to do. There are things you need to do. Everything has to be in moderation. Everything has to be in its place. Everything has to serve its purpose. Okay, so when you are sick, you go to the hospital. The people there are also Christians as well. I know professors that are priests, whether in Catholic Church, in any church you want to mention, Methodist, Anglican, any of the Pentecostal churches. We have professors that are medical people. Okay, in all fields, people that are serious with their religious practices. So let us not, twist these things and make it look as if anybody's fighting anybody. So please, that's one of the West African perspective. Let religion not steal, the benefit we should get from preventive care. Then the last one is scarcity. Okay, scarcity of a lot of things. Scarcity. Okay, I cannot even begin to talk about that. It's also likened to powerlessness. Scarcity of healthcare people. Now there are a lot of policies that are against doctors and nurses and other medical people. And even against the masses generally, suppressing us from accessing preventive care. So please, let's be aware of these things. This the very first, the key word in all of the things we are talking about is proactiveness. Okay, the key word again is awareness and then being able to do something about it. Now, let me round up with this story. I'm sorry I've taken much of our time. We are over 1 hour into this. Okay, so let me share this story on the end. So it's a story about a 20-year-old girl that had type 1 diabetes. Now, this is one of the non-communicable diseases. Okay, so now she was. Remember, we're talking about West African perspective. Powerlessness, attitude, the big attitude, religion, scarcity. So poverty, ignorance, gross irresponsibility, like I said before, the big attitude. Now, all of these things played out in this story I'm about to share. So just to cut the long story short, it's a story about a girl that we met in the hospital now. But before then, the mother, who was really poor, saw some symptoms that looked as if the girl, stepped on jams. Her leg was gangrenous, dark, in simpler terms, dark, and was dying off, kind of. So the mom took this 20-year-old to the prayer house, and they stayed there for months, maybe 3 months, maybe almost to 6 months before they now came to the hospital. Now, initially the leg was not that dark, but progressively it got worse. And the girl was now septic. She had fever, she was very weak, her eyes were yellow, she had jaundice, a lot of things. She was dehydrated, a lot of things were happening to her. So they couldn't hold on anymore. They now had to carry her to the hospital. Now in the hospital, long story short, she had bilateral above knee amputation. That's in simpler terms, her both legs were taken off from the above the knee. Just imagine this girl, 20-year-old young girl, very beautiful, with no legs. That means marriage. Of course, what you know. And you know how ladies of our time, when no shades, or you know how you can imagine, just like the guys as well, you're imagining how you dance on your wedding day. That one is gone. Assuming you even be married, somebody will marry her. I just want to say the hard truth the way it is. Okay, I'm not trying to shade any person with disabilities or all of those things, but let's just think about the realities. So this young girl was depressed, very depressed. Aside that, when we prescribe antibiotics to get for her, they cannot even afford the best of the antibiotics. They go for the simpler things, the small, the empirical ones that will not even do anything. The one that cannot even target some of them. When you do culture and sensitivity, there are some drugs like imipenem, some big drugs that you can get, but they are very expensive. They can't even go for the next, rated ones. The least is what they could buy. They can't even buy one to take the drugs. So it was very crazy. We had to. This thing happened when I was a student. We had to still, we donated blood for this young lady, we contributed money, we did a lot of things. Yes. So to cut long story short, few months in, she died. She died. She died, guys. She died. You could imagine how terrible the mother felt. And it was all of these things playing out. Powerlessness, big attitude, okay, poverty, ignorance, gross irresponsibility, you know, religion as well playing out, scarcity of things. And at the end of the day, she died. And there's a story about a friend of mine as well that I was just talking like I'm talking to you now. And I said, please take your health seriously. Don't be indifferent about these things. Take charge of your health. Be proactive. That is what preventive health care is about. And this my friend had pain for years, over 5 years, had pains, and he was online like this. We were just talking. And I said a lot of things, just like I've just narrated with you guys this afternoon. And I just said one thing, please don't take anything lightly again. Don't mix things up. You are sick, go to the hospital. You need spiritual help, go to church. But if you need something that is physical, go to the hospital. If you are sick, you have symptoms and signs that shows that you are ill, go to the hospital. And then, long story short, this my friend went to the hospital and he was diagnosed of mid-gut volvulus. That's like the intestines were twisted. And the doctor said that if he had stayed longer than this, probably it would have been worse. You might even have short bowel syndrome, because when you now have to cut, take a segment of that dead and dying or a gangrenous segment of the intestine that is as a result of that twisting, it will cause the bowel to reduce in size, and that's the problem, because you might cut off the part that is responsible for taking up water, the part that is responsible for taking up some important nutrients, and that will cause that person another problem, like the nutritional deficiencies, short bowel syndrome, with a lot of things that it comes with. So, well, long story short, this my friend had help. Simple, just did ultrasound, they diagnosed what was wrong with him, did the definitive surgery, and he came back home a few days after, and he was good. And I was telling Prosper, I think it was yesterday, that my friend got me shoes just to thank me. Said, thank you so much, Dr. Ruby. Thank you for that simple advice. And that is what I'm about to, that's what I've already, not about to, I've already given to you today, free of charge. Free of charge. And that's the thing. Okay, people stay hours just to pay. You pay hourly just to hear what you've heard this afternoon. Okay, so guys, please don't take this thing lightly. And that's why I wore this my shirt today. Okay, let me bring my lights closer. You see, secure our land. So that's what we are doing here. And we are doing this by means of what? This webinar, preventive care webinar. Okay, so thank you guys for listening. Let us secure our health. Okay, yes, let us do well to take in all we've said, absorb it, and use it for your own good. Thank you for listening, and God bless. So, Prosper, over to you.
All right. Thank you very much for that very direct and awesome session. Like, I wrote down so many things even for myself, and I'm sure that our audience have gained a lot. Starting from the your definition and the proactivity, the HHH, I believe it's very catchy and simple for our audience to get. The healthy health habits. And then you listed some very important key points like exercise, the balanced diet, and portion control. The sleep that has to be 8 hours, the prudent hydration, taking in enough water, the positive mindset that we have to have, staying informed, health education, and other things you mentioned. You also talked about the fact that pregnancy is not an emergency. It's not an emergency. You talked about albinos and how they should, not expose themselves to the sun. Be proactive about it. And then avoiding abuse. We talked about health insurance. And then there is something you said that was so outstanding. I had to just write it down, underline it. Very important. And I think this is one of the biggest things I'm taking home today. That most diseases are not just preventable, but they are also predictable. Most diseases are not just preventable, but they're also predictable. So you can know that these things are coming. You can see these things on the way and take actions to prevent them, and take good health, actions to prevent these things. So yeah, it's a big takeaway. And if you're listening out there, most diseases are not just preventable alone. They are predictable. You can see these things coming and then take actions to prevent them. You also talked about washing your hands. You don't just come back from the market and, carry your baby just like that, right? You have to wash your hands, or even take your bed, because things you met in the market, right? You don't know some of the things that happened to you in the market. And then you talked about PARS, which is PARS, powerlessness, attitude, where you talked about the big mentality. That was also a big takeaway, a big eye opener. And then religion. People shouldn't just take things that should be addressed by the medical sector to just religion. And then scarcity, right? And then you summarize by talking about the key word, which is proactivity and awareness. Very important also. And the stories you shared. It has been an awesome session. Thank you so much, Dr. Ruby, for being on here today. Thank you for sharing these awesome insights. Then a question here. There's a question here. I think we can just take 2 questions. We'll take just 2 questions. All right. We'll take 2 questions. And we're going to be taking those questions in the community. So if you're not part of the community, the link is going to be dropped down. The link is going to be dropped in the comment section so you can join the community. Dr. Ruby will be there to answer your questions. You can ask your questions anonymously or you can come out and ask it yourself. So thank you for being on here with us today. This is Preventive Care Webinar, the first edition. I'm also, inviting you to the next edition, which will be next month, where we're going to be learning about our health also, talking about our health, Okay, Dr. Ruby, can you hear me?
Yeah, I can.
All right, okay. Okay, you can take some of the questions here, right?
Yeah.
All right. We can just take two questions. So the first question here is that can you still hear me?
Perfect, I can.
Yeah. All right. Considering the current state of hardship and difficulty in Nigeria, how can one begin their journey to preventive care? That's the first question.
Okay, thank you so much. You've been, you can just mute. Just
I can hear you. Yes, I can hear you.
I can mute. All right. So yeah, thank you so much. It's better now. So I was saying that most of the answers you need has already been dished out, right? Very much importantly, okay, is the fact that there are things you can do for yourself. Let's start with those ones. I don't know whether it makes sense. There are things that you can do for yourself. So start with that first. Go start with that. Okay, it's very simple. Start with that one you can do for yourself, and we've listed them. There are ones you can do for yourself. Yeah, do you need money to sleep? You just need a house. Okay, you just need a bed. You need somewhere to just lay your head. So you do those ones. But I also know that, just like I said, I'm almost like shooting myself in the leg. You might need a house. Somebody might argue. So let's now go to the next things. There are a lot of things. The Bible says that money answereth all things. And if you've read books about money, you know how important it is. So yeah, I know most of these things we are talking about in a fiscal world, the means of exchange of value is money. You even need money to be online, to be on in this meeting. You need to buy data. So I understand the importance. Okay, the importance. And I used to tell people that money is not important. Money is very, very, very important. And I fought somebody because the person said money is important. You know, money is not important. It's very, 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 very. And the reason why I fought was because the person did not say very, 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 very. Okay, so that's what we are talking about. Okay, so we can take the bull by the horn. They have mentioned things about health insurance, which would have been nice, some policies from our government. But since our government is not helping us, we have to take the bull by the horn. Keywords like you mentioned, become proactive about it. So save money small, small. Get into health insurance that you can be paying small, 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 small. Maybe for your kids, maybe for if you couldn't benefit from it, other people can. That's why we are living. You cannot allow yourself to pass through something and allow other people to also pass through it. It's not nice. When you are there, the next keyword is awareness. Now you know. How do we move through this? You just have to try. Okay, we have to try. Save up money for it. Prepare, for crisis. Okay, when you have maybe a parent, a child, or anybody with chronic diseases, you don't just leave them like that. You have to prepare. Okay, then also for your own self, you have to be proactive. Check out yourself. These things will not cost much. Let me tell you guys, to be honest, you see, when you actually come down with the real thing, money will come out. Money will come out. The things we are complaining about, it will come out. So I'm not here to judge anybody. Maybe you are still, you are hustling, you don't have much. Start with the little things you can do. Okay, go to a government hospital where some of these healthcare stuff are, they've reduced, the prices for, assessing some of those things. Okay, you can also do that. Get maybe volunteers, NGOs, when they are running some of these things, join in, volunteer. You might meet people that would, put you into some of these things that you will not pay for. Also, if you're a government worker, or maybe your wife is not a government worker, you can also try and get a job, that will bring them into health insurance. I'm sure if you're a copper here and you're listening to me, you have like health insurance. In case you don't know, you have health insurance in your package. So far you are um working under the federal government, or you have something to do with federal government, you have your health insurance which has been paid for. Okay, so go assess your health this thing. Don't stay at home and say, you don't have the money. Go, you have it. Okay, so once you are there, you see that some of the things, maybe investigations, some payment for surgeries and all of that will be reduced. Okay, so get your health insured. That's one. Do the ones that you can, the ones you can do. Above all, there are things that you can control. Start with those ones. Those little ones. Start with them. Thank you.
All right. Thank you very much for that wonderful answer. Thank you so much. So you've heard that. Start with the ones you can do. Start with the ones you can do. Then the second and last question here is that um, people share ideas and things that have worked for them when it comes to health. People even share things that are dangerous when it comes to health. So how do we know what to follow? How do we know who to follow? How do we know who to listen? I think what this person is trying to say is that, probably someone took a particular medication or a particular remedy and it worked for them, right? And then they are talking about it, sharing it all around. And also, the second part of what he said is that, some people think certain things are dangerous. I've seen people that think maybe vaccines are dangerous, or just like the COVID-19 period, the people were saying these vaccines are dangerous, they are initiating you, all of that, the religion you talked about, and all of that. So, how do people know what to listen to when it comes to their health and things that pertain to them, become staying healthy, steady, robust health? How do they know what to listen to? What is good? What is bad? What works? And how should they navigate that?
Okay, thank you so much.
Okay, thank you so much.
There's one adage I'll start with. Sometimes I like to talk like an old man. Eh? You might think that dogs don't talk just because they call it barking, but they talk. That's their talking. Okay? You might think that snakes don't talk, but they are hissing, abi? Just because they call it hissing, abi? You think it's not, there's no communication there. Okay, be playing, be playing. Okay, so what I'm trying to say in essence, in simpler term, is this: the what we need has been provided for us. A lot of us cry to God, God, please give me tables, give me tables, give me tables, and God is saying, look at this one now. You know, look at this one. I've given you 10 billion cells to think. You know, I've given you a whole lot of access. So when you need help like this, go to a professional. The answer is simple. That's what I'm trying to say. It's simple. The communication there is simple. We are the one that are making some of these things difficult for us. Like I said, just because you think you see a dog barking, you think they are not communicating. That's wrong of you. You are myopic. Because you see snakes hissing, you think they are not communication. You are being myopic. So God doesn't make tables. He has already created trees. So you may as well make anything you want. You can make doors, chairs. You can make lawn tennis table. If there is no tennis table anyway. You can make table tennis table. You can make dining table. You get anything you want. So I know I'm diverting a little, but this is my point. My point is this: when you need such help, seek professional help. You cannot be looking for healthcare services and you go to a pastor. Does it make sense? No. Okay. If you want to repair your car, do you find a medical doctor to repair your car? Is it not your mechanic that you call? It's your mechanic. It's very simple. These things are quite simple. So choose who you listen to. Okay, cell is like a semi-permeable membrane. You have to sieve this information. And the only way to get the right one is to seek professional help. Okay, go to a somebody that is certified. Don't, like I said before, like I said, most of the answers to this question I've already laid it out. I think most of the things I talked about, we are not big English. I brought it down to simple things that we can do, whether it's for you or for someone else. I shared it like that, bit by bit. So what I'm saying in essence is this, okay? Seek professional help, okay? And with target of getting things right. Don't take advices from people that are not professional. As simple as that. Don't go to take Google cleanser, bring mix this thing and this one and the other one. Now, the vaccination part, most of the medications are poisons. Okay, even food that we eat are poisons. Anything that is foreign is poison to the body. It's facts. These are facts. But we, as professionals, we tend to know which one is less poisonous than the other. You get? Which one can we maneuver to for the body to look at it differently? And that is why we don't just give you, it still helps. I know it helps and all of those things, but we take out the active ingredients and even not just leave it at that. It's being tested. These professionals run researches, test it on animals, on lab rats, to different levels of these clinical trials they do before those drugs are dished out to the society. Okay, so these things are scrutinized. It's meeting upon meeting. It's just like Senate president's work. Okay, I mean the Senate House or Assembly. It's not just pass bill and just take it. It goes on and on, like three readings. Before somebody can adopt it. People argue. People say no, it's not good. We throw this one. Some of those medications you see now have been trashed many times. Have been disapproved until they kept on working on it until it was safe enough. And there's even dosage to make you understand. This thing you don't just give it, there's dosages. It's being rated, it's being graduated, down to what is required per day, per month, per week. Even the toxicity is written on every drug you bring. They write it for you clearly. This is what it can cause. Some side effects are also beneficial for certain other diseases. There are some drugs you might be using just because as a professional, you know their side effect, and the side effect is what is desired for this other illness. These are scientific facts. So please don't be scared, okay? If you hear anything, it's right, it's only right, just because you need to be safe on your own part. So just discuss them with your professionals, and they will give you their best shot and their best advice. But for me, please, in summary, whenever you have some of these concerns, take it to a professional. And here I am as a professional telling you, take it to a professional. You might not see me in person, but the way the training is, anybody that has been certified is actually qualified. Thank you so much.
Wow, 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 wow. That has been a very insightful one. So, take it to the professional. As simple as that, as easy as that. When you hear something about vaccines that makes you scared, take it to the professional. When you hear people that said this works for me, that works for me, take it to the professional. Let them talk to you about it. Let them talk to you about it. And Dr. Ruby has made it very clear and simple to understand.
Here to add,
Yes, okay, yes, you want.
I want, yeah, in this instance, prostate cancer, uh, our time is already fast spent. So, can you hear me? Okay, I'm sorry, guys. The life of a doctor, a lot of calls, from time to time. I'm really sorry. Okay, I just want us to conclude, on a very good note. So let me share this story. I was saying that we have a lot of people that are coming down with prostate cancer, and what we do for them is almost like a primitive practice. Bilateral orchidectomy, you cut off the balls, but it's still scientific in the sense that testosterone is one of the things that makes the prostate to enlarge, and a bulk of it. Can you hear me? Okay, so when you cut off the stimuli, okay, the what is it's the response to that stimuli, okay, will also be adjusted. You understand? If I hit a wall and stop hitting, wherever I stop is where it will stop. But if I continue, I might break, break it down. That's the way it works. So when you cut off that testis, that's what happens is that the prostate will start to shrink. Okay. And a lot of the other signs and symptoms, lower urinary tract symptoms, go off. Any other symptoms the person has developed, weight loss, yellowness of the eye, those things will go down. So what I want to say is that, so I heard a man that was, in his concern, he said that it was a nurse even. I'm not trying to shade nuts here, but let's say the person is not also aware, because there are levels to these things. That's why you keep on learning. Nobody knows everything. Okay, you keep on learning and improving. You know, maybe you might have a nurse, but the person is not that qualified. You understand? That's why I said it's only when you are certified that somebody can say you are qualified for something. That means you've gone through it. People have scrutinized you. People have asked you this kind of question plenty times. When you did not know, you learn now how to ask, and you knew about them. So the person, just to cut the long story short, the person had been told that if you do there's something we call the prostate biopsy. There's a gun that will be inserted into your anus, and then they'll shoot from the back, just to get a sample, to know the staging of your disease and know the right therapy for it, the right, whether it's surgery or medical management, depending. Because sometimes you might do it and it's just BPH, it's just benign prostatic, it's not malignant, it's not cancer. So at least even though it's not like there are other clinical things and evidence that will help you, like bone pain, weight loss, anorexia, that will make you know that this is cancer. Maybe when it has metastasized to the, like, spread to the brain or to the lungs, or so to the bones and other place, you can know. But this man was afraid that once you put in that needle, that it will get worse. And that's a lie, because if it actually is true, we wouldn't be practicing it again. We would have become obsolete, and we say, no, this one is not working for our patient anymore. But it doesn't. So you see, it was only when he was able to talk to us that we were able to counsel him. And counseling, I said it before, is also part of therapy. It's important. There's no patient that you've treated well that you only go and treat the body. There is the spirit, soul, and body. That's the way it is. It might sound religious, but it's true, it's fact. Okay? So the way people study sociology, sexology, all these things, geology, all those things are important. You have to bring all these things, together to be able to treat a full human being. So those are the points. So what I'm trying to say is that please let us not be misinformed. And that's why I'm pointing everything back to the professionals. Thank you.
All right. Thank you very much, Dr. Ruby. That has been a very nice one. So back to the professionals. Always take it back. Always take it back to the professionals. Our time is already fast spent, and we're going to be wrapping it up here. Other questions may probably drop in the community of people that registered. So thank you so much, Dr. Ruby. We are very thankful and appreciative for having you on here today. Thank you. You've shared so many things. Thank you very much. And then to our audience out there, you learned a lot. Please begin to put these things into action. It is garbage in and garbage out. What you put in there, that's what you get out of it. All right, Dr. Ruby, I'm going to be dropping you now. All right. So thank you very much for participating in this webinar. I've already written a lot, and learned a lot in this webinar. We'll see you next month on the next edition of the Preventive Care webinar presented to you by Lawson Health. Once again, I'm Prosper with the CEO of Lawson Health. Thank you for being on here. Follow our Facebook page where we drop daily health tips to help you better your health. You can also join our WhatsApp community. If you want to join the WhatsApp community, you can comment. Place a comment. You can comment on the comment section so that we can add you to the WhatsApp community. Follow us on Facebook. Follow us on Instagram, and always keep an eye so that you will keep improving your health. Cheers to steady, robust health, and thank you for participating in the Preventive Care webinar, the first edition. Cheers.